You are listening to the Horse Radio Network, part of the Equine Network family.
Greetings, everyone. Coach Jen here, and thanks for tuning in to Horse Tip Daily, episode 1572, brought to you today by Equestrian Plus. In today's tip, Horses in the Morning co-hosts Glenn and Jamie are joined by Dr. Pierce, who explains corneal abscesses.
Recharge your training program with Equestrian Plus. Equestrian Plus brings together top riders, trainers, and professionals onto one video platform. Watch over 5,000 how-to training videos, clinic and event footage, exclusive training sessions, and more featuring top experts including 5-time dressage Olympian Stefan Peters, 5-time Olympic show jumper Ann Krasinski, Olympic eventer and silver medalist William Fox Pitt, and more. Join Equestrian Plus now and use promo code HRN15 for 15% off your first month. Visit equestrianplusplus.com to subscribe.
Horse Health Report is brought to you by Daily Dose Equine, non-GMO core nutrition for horses and ponies of all ages. I am pleased to welcome to the show today Dr. Pierce of the Veterinary Vision Center in Shreveport, Louisiana. Dr. Pierce, thank you so much for joining us.
Thank you. Thank you for having me.
So are you a specialist in eyes, or are you a veterinarian, or what's your title there?
Yeah, so I'm a combination of both. I am a veterinarian first. I got my veterinary education from Louisiana State University and then pursued specialty training, small animal internship at the University of Tennessee, ophthalmology specialty internship in Southern California, and then ophthalmology residency at Michigan State and completed that and have been an veterinary ophthalmologist for over 17 years. And then I've kind of traveled all across the nation from being in academia at LSU right after residency to private practice in New Jersey and in Dallas, and then opened up Veterinary Vision Center in Shreveport, Louisiana, servicing this underserved region of the United States. And currently I'm the only specialist in this region covering northern Louisiana, eastern Texas, and southern Arkansas. So.
Wow, you're an eyeball guy. I mean, good Lord, you know a lot about eyeballs if you do all that. That's amazing. So do you say you do mostly small animal, or do you do large animal as well?
Small, large, as well as some exotics. Not many exotics in this region, but we do see them, but definitely on a daily as well as weekly basis get a fair bit of equine cases where we see out of Red River Equine in Benton, Louisiana there.
Okay, well,
classmate of mine owns that practice. Sorry.
Oh, that's nice. That's cool. So you study eyeballs. I've been told as a horse person, and like we talked about before we came on, I've spent a vet bill on every single thing horses can do. But the one thing I do know is that if it's an eyeball, call the vet.
Yes, definitely. If there's any eye-related issue, I mean, your first line of defense is definitely your primary veterinarian, then, your specialist, but in any situation, definitely when we're dealing with the eye, even if it's your own personal eye, don't wait. That's the biggest advice I can give, and best advice is if there's a problem, get it checked out right away. We're dealing with not only our pet's vision, but sometimes even their quality of life, and that can really be affected and change the trajectory of how we manage them, how we keep them moving forward. So definitely get it checked out as soon as possible.
One of our listeners requested we talk about corneal abscesses. Now, I do know what a corneal ulcer is. Is an ulcer as an abscess an ulcer that's gone wrong?
In some instances, yes. So an abscess is almost just like, I would think of it almost like a pimple on your skin. So it doesn't necessarily need to actually have an external break on the surface for it to develop, but it is mainly just an accumulation of white blood cells in reaction to some organism, whether it's bacteria or fungus, or sometimes there isn't a specific organism, but our immune system just comes into aggressive to address said problem and develops this accumulation of cells that causes not only inflammation within the cornea, but potential damage to the eye itself.
Dr. Pierce, I hate abscesses in feet. I can't imagine that in an eyeball. That's just grossing me out over here.
Glenn, this is perfect for you. We're talking about pus in an eyeball.
Yeah, I'm out. I'm just.
So what do you do for a corneal abscess then?
I don't want to know. La 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 la.
You leave.
Yeah, so it's not like it's not fully like the skin. Like we don't want to just go to the cornea of your horse and like try to pop it and express. So there's definitely a couple of ways that we address it. By far, the main way is with topical medications there. So whether it's a combination of antibiotics or as well as antifungal drops, even anti-inflammatories, as well as a combination of oral meds as well, just depending on what's going on within the cornea and how we could get drugs delivered to this area of interest. Part of the issue is with our corneas, which allows us to see evolutionarily, is that our corneas are clear, they're transparent, and they are void of blood vessels and any other thing that can obscure our vision. That's great, and that's what we need. But when a problem develops, when an abscess develops, then that lack of blood vessels or lack of access to the immune system getting to said area of interest right away and resolving it allows these abscesses or organisms to develop, proliferate, and become very problematic until the immune system is there at a point in time to be able to do something about it. So that is some of the kind of problem. And then horses in particular are unique in that they like to allow fungus to harbor in their cornea. It pretty much down to the very innermost layer of the cornea called Descemet's membrane. And that's mainly due to the collagen and glycosaminoglycan makeup of the cornea compared to like sheep and goats and cows that live in the same environment as these horses, but we don't see nearly as much fungal abscesses or ulcers in horses in other species as we do in horses.
Yeah, so they have a special talent of trying to hurt themselves extra.
Yeah.
Apparently, biologically, that's true too.
Yeah, exactly. So is there a different treatment for horses versus other animals?
So, horses with abscesses, there's a couple measures that we do that's a little bit more than what we would typically do. One, the other aspect of it is not in our like sheep and goats or cows that get abscesses. One, they don't get it as often, and two, they kind of typically can be addressed medically. In horses, some of the issue is also balancing their pain and discomfort and the inflammation that the eye develops there, right? Sometimes the eyes will be so inflamed and so painful that even trying to medically manage or even just medicate the horse in general can be, very risky for your own safety, for the horse's safety, as well as just trying to, resolve the problem. Medical therapy can take, 4 to 6 weeks or longer, depending on, what it is that we're dealing with. And then some of the things that we do differently for horses with abscesses is actually surgically to cut the cornea, punch out the area or the abscess of interest or what have you, and then try to patch that portion of tissue that we take out. And the whole goal of that is we're removing, if not all, the vast majority and bulk of this disease that is causing major problems, stimulating the immune system, causing a lot of inflammation within the eye, in an effort to not only calm down that inflammation, but also speed up the healing time. Typically with surgery, even though it might be a pricier expense compared to medical management, will yield a lot quicker results of resolution, less time having to medicate potentially, and then a more successful outcome for not only resolving the abscess, but having a visual eye at the end of the problem. Sometimes as we medically manage some of these abscesses, again, we might be treating this eye for 2 months. 2 months of inflammation in the eye or any body organ is going to cause a fair bit of scarring and damage. And sometimes that can be enough to where we resolve the abscess, but the eye only has light perception and can't fully see, or we've significantly reduced vision in that eye. And granted, some clients in some situations, financially going to surgery is outside of everyone's budget, which is totally understandable.
Okay.
So medical management is still a viable option.
Dr. Pierce,
Yes.
I got to say,
Right.
as a horse husband, I'm going to ask the question that we ask every Wednesday when we do these health segments is, why do we own horses? Why do we do this to horses?
Now, back to what he was saying, Glenn, because we're going to own horses no matter what. So because when you're treating an eyeball, for those who haven't had to do it, I mean, it's every 2 hours for the first week and every 4 hours after that. And even with the lavage system those horses can become, they're not happy to see you. Like you walk in the barn, they are not happy to see you, even with the lavage system. So surgery is an option for pretty much, is surgery an option for scratches as well, or just the abscesses?
So for corneal ulcer or a scratch, it depends on the integrity of the cornea, how it looks, and if surgery is warranted or not. Typically with an ulcer, in really broad general terms, if we have an ulcer that is kind of eating away or digesting the cornea, once we get past half of the thickness of the cornea that's involved,
Mm-hmm.
and we started to get like 60, 70, 80% of the cornea that's been eaten away, then we're needing to do surgery to not only
Gotcha.
kind of clean up the wound, but also kind of restore the thickness of the cornea that's been eaten away, because that cornea, as it's becoming thinner, is weaker, and that can easily lead to rupture of the cornea or hole in the cornea because of how the globe is pressurized, as well as the extraocular muscles that the horse has as they are moving their eye around is creating a lot more pressure on the cornea and on that weak spot. So it's almost can act as like a hinge or a fulcrum.
Glenn, I know you're grossed
Very
out,
thin.
but this is so fascinating.
Well, what
to me.
I want to
just,
know,
love
what I
every
want to
second
know,
of
what
it.
my next logical question would be is, okay, so let's say the medication works or the surgery or whatever. What about reoccurrence?
Mm-hmm.
We see, I've had horses that are abscess prone, right? They're getting abscesses all the time in their feet.
Mm-hmm.
So is that true of the eyeball too, or do you not see that
Good
as often?
question.
So not so much, not as common as we see with horses that get, hoof abscesses or what have you. There is always a possibility that a new abscess can develop in a cornea, maybe in a different location from where the initial one developed. It also depends on, sometimes with the cause of the abscess forming. But it's not guaranteed that if your horse has a corneal abscess, that is going to develop another one, or it's going to develop the other one in the contralateral eye.
Well, that's good news.
Now, I say that to say we all have these stories, as specialists of that one horse, right? And I'll give you an example. There's a horse that I saw out here developed a small abscess, which is perfect for doing surgery. The smaller it is, the earlier intervention, the better, right? Took it to surgery, punched out the abscess, put down the new flap of cornea over it, healed up beautifully, eye still visual. 3 years later, the horse developed an ulcer at the edge of where the surgery was performed, and that started to eat away at cornea to where the horse needed a different type of surgery to perform to patch that area that has got eaten away. So it wasn't a new abscess, but it was a new kind of ulcer type of problem that led to the cornea being digested at the same location of where we did surgery.
Can I just say, Dr. Pierce, though, that it's amazing that this surgery even is there and is successful and that you can do it. I mean, that's just amazing. 20 years ago, you'd taken the eye out, right? So it's a whole different ballgame now. It's amazing that you can do this stuff. It's just medicine has come so far.
And I would tell you that your horse's eyes look terrible when they are inflamed, and when they have abscesses, you'll see all kind of colors: yellow, green, red, blue, the whole shebang, all within the cornea. And you would think, my God, how can this eye be turned around. And with the proper medication, proper intervention, and time and diligence of the, horse owner administering these medications, it will pay off. And these eyes can turn around and go back to being clear and go back to being sighted too. So even though it's hard to see the forest from the trees when, you presenting your horse to your ophthalmologist or to your doctor, and the eye is got the rainbow of colors in its cornea there, it can definitely turn around. You just got to be willing to go through the labor, go through the fight. Yeah, put in the time, and it can change.
So with this, give me a little bit of hope. Is there anything that we can do to prevent corneal abscesses? He's going to say no.
Yeah, there was hesitation there.
If I knew that miracle cure, no. So I think, as we are dealing with our horses, so one is definitely on a daily basis, look at their eyes, right? Don't blow off times when they're tearing a little bit more and assume, it's just the wind or it's allergies or what have you. If they've been rolling around, their face is dirty, they're tearing a little bit, they got a lot of kind of discharge coming from their eyes. Take a bottle of eye wash that you get from the drugstore, over the counter eye wash, and just like rinse their eye. They may not like it or whatever, but give them some additional kind of flush out any debris that may be there. Horses do good with tearing, and they produce a fair bit of tears to kind of clear off the debris that they have, that they may accumulate. So sometimes they do it for us. The other advice I would say is, if you have lubricants, either gels or ointments, like those won't ever hurt. So if your horse is prone to constantly getting stuff in their eye, artificial tear ointment will be helpful. To, again, just kind of make things oily. That may reduce some of the irritation factor. Probably the best intervention is early intervention on the owner's part, right? If you notice something, do something. Like either that day call somebody or the next day get your horse evaluated either by your vet or to an ophthalmologist. Definitely, if you have an ophthalmologist in your area and your horse has got eye problems and your vet has recommended that you see an ophthalmologist, don't skip on that. There is significant value in ophthalmologists looking at your horse's eye and giving their recommendations. It's always up to the owner to decide on if they're going to pursue and follow those directions or not. But that valuable information that ophthalmologists and specialists can bring just adds to your ability to make objective decisions for your horse and what you want to do.
Well, veterinaryvisioncenter.com is where you want to go to learn more about Dr. Pierce, to get in touch with him if you have any questions or anything. And thank you for doing what you do.
Well, there you have it. Horse Radio Network has thousands of engaging podcasts for horse people, and you can have them sent right to your phone. Just subscribe via your favorite podcast player. This is Coach Jen, and I will be back again soon with another tip. Until then, go ride your horse. The Horse Radio Network and the Horse Radio Network hosts are not responsible for statements made by guests on the Horse Tip Daily. Please use your own judgment when listening to the tips on this show.